Planet Vero Studio is powered by the Nolan Group of Remax Associated Realty. MyNextHomeFinder.com.
Welcome to Treasure Coast Community Health. We have 8 locations to serve you better. Our staff is dedicated to help you and your family. Here's your host, Vicki Soule.
Hello there, and welcome to Community Conversations. As we roll up to the end of the year, there's lots of time to think about our families and our friends and what the new year might present. I know I've heard over and over and over again this past year, let's go back to our norm. Well, I'm not sure that we're ever going to have a norm that was the same as it was a couple of years ago, but looking forward, we certainly can create a new norm and take care of some of the things that still bother us about what's gone on in the past. And no, I'm not going to talk about COVID virus. My guest today is Sheriff Eric Flowers, and we're going to be talking about our community because as a nonprofit, Treasure Coast Community Health knows that they can't take care of everything without good partnerships. So welcome, Eric.
Thank you, and thank you for your partnership with our agency. We certainly appreciate that. We've got a lot going on in the jail, and you guys have stepped up to help us in our correctional side. We're still working through some contracts and getting us to a point of where we need to be to ultimately have a solid partnership. But everything has been fantastic. Your team has been wonderful. And I can't say enough good things about Treasure Coast Community Health.
Thank you.
Our ultimate goal here is that our inmates recognize the value of your organization and that they recognize that the care that they're getting in our facility is the same care that they can get on the outside, and
many of them have already.
Yes, good. I'm glad to hear that. It's so far it's been a fantastic partnership, and I look forward to many years working with you guys.
Thank you, as we do, because again, these are our brothers, sisters, fathers, uncles. You know, they are community members. Not all of them do we want to own as relatives. Some of them have done some pretty serious things that we're not proud of. So we kind of disassociate. But the reality is everybody needs to have good care, regardless of the decisions that they make. So that's what we're offering is good, consistent care throughout their lifetime here.
And, you know, the reality is you guys are also offering care that we've never had in the jail before. I mean, you offer dental services, you offer mental health services, and those are all things that, you know, we had to some level, but we've never had a one-stop shop like you guys offer. And so we've parsed that out in the past with, you know, telehealth and a variety of other things. But the way that we're offering it now to inmates, I think, is really going to make a difference in the lives. And ultimately, you know, our goal is to rehabilitate these folks, you know, get them back on track to being productive, tax-paying citizens. And, you know, we believe that by offering this quality health care, having them know where to go when they get back out, that will hopefully help them stay on track with their lives. Dental care helps you get a job, helps you move forward with your life. So all those things work in conjunction to make our community better.
And certainly you touched on the mental health portion of it. And, you know, the reality is medicines do help a certain population.
Yes.
And if they can't get them when they get out, you give them a limited supply, understandably. But being able to access somebody that they talked to in Texas last week is not a big help to them here in Vero this week when they're discharged.
And that was one of the problems that we saw. We had people that were doing telehealth that was out of state, and the minute you're released from jail, you no longer have access to those services. And so by having TCCH as a partner, they're able to go to one of your many locations. You know, if they live in the Fellsmere area, they can stop into your Fellsmere.
Well, we have telehealth too.
Yeah, you do as well. Yeah, absolutely.
But they can pick up the medications either at Fellsmere, Oslo, or now at our Gifford location.
Yes.
And that makes a world of difference because we make them affordable for these folks. And so there's really no reason why they can't get them in terms of physical barriers, at least.
I still believe that when we finalize our partnership and we get it, you know, set in stone, we get a couple years under our belt of providing this service. I honestly believe that there will be people that come from all over around the country to look at our model to say, how are you doing this? And because, you know, the majority of jails and prisons around the state and around the country have private health care that they're paying millions of dollars
I only
to.
know of one other federally qualified center in the whole state.
Yeah.
Marion County's been doing it through Heart of Florida for about 3 years. They've figured out a lot of things because there is another FQHC that originated in Washington, D.C., But you're right. Most of the community health centers work on those walkie-talkies that are free and loose around the community.
Yeah.
And this is an entirely different model.
Well, we spent a lot of time traveling and looking at other providers, these private companies. And the reality is, if you're a for-profit medical company that comes into a jail, at the end of the day, it's about the bottom dollar for you. And they're going to try to provide the lowest possible care at the lowest possible price. And that's not what TCCH is about. TCCH is about being a good community partner. And like you said, these are folks that are in our jail that are relatives and friends. And
sometimes now, because of COVID, for a very long time.
For a very long time. The court system is backed up. The court system will continue to be backed up. There's no way for them to catch up. I mean, it was backed up before COVID ever hit. So the idea that some of these cases are going to get resolved anytime soon is just not realistic. So I think, having them have that quality health care, a place to go to, it really makes a difference.
Well, and I think that, some of the programs that we started before COVID, treating individuals to more education about what causes their mental health outbursts or medication-assisted treatment, to try to get them so that their brain chemistry can restabilize, because doing drugs does alter that mental status, not just for that time period, but for some after effect. Yeah. So sometimes we do need to put people back on a certain type of med that's more controllable, easier to wean them off of, so that their system reaches that stability point while they're living the life they'd like to live, as you mentioned, getting the job, and having that stability in their life instead of where they've been. The
problem that we see is that the majority of these folks that come in have co-occurring issues, right? Mm-hmm. Many of them have some sort of underlying trauma. I
heard something like 75%.
It's a lot. It's a lot. Very high number, right? So they've got this trauma. They're self-medicating, whether that be for through alcohol or substances. And then on top of that, many of them are suffering from either depression or mental illness that's associated with their trauma. And so we never get to the root cause of trying to treat some of these issues. Right. We're putting Band-Aids for the most part. And I think that's nationally. I don't think that's anything locally that we're talking about. I think that the majority of people get Band-Aids along the way. And so, when we get these folks in who, like you said, their brain chemistry is so off balance because they've been abusing drugs, they've been abusing alcohol, they're not treating any of their issues. And then as soon as you start doing that, all the other things go out the window. So your personal hygiene, your health, all that goes by the wayside, and those things make it compounds. And I think they get into a position where there's no way out, where there's no way for them to reach up. And so to be able to offer them a place to shower, and it's an unfortunate thing that jails will always exist in our society, right? I mean, my ultimate goal would be to close the jail down because we don't need it. I'd put myself out of a job if I could do that.
Me both.
Yeah, but the idea is that while they're there, we're not just incarcerating them, but we're really trying to get them back on track. And there's some people that are very close that we can offer a GED to, that we can offer training programs to, and they can make the turn in no time, and we can get them back on track. And there's some folks that are so deep inside that we've got to just try and chip away at those layers, those hard shells. And it may take somebody from your staff to connect with them to be able to pull them out, and whatever it takes, that's the ultimate goal. And we realize there's some people we're never going to rehabilitate. Totally understand that.
And Carrie Lester Maynard from the Substance Awareness Center said it's typical for an addict, for example, to have 7 remissions before it catches. Yeah. People who've been incarcerated are kind of, I don't want to say they're all in that bucket, but many of them have got to fail again before the light bulb finally clicks on and they say, this is not what I need to do.
Well, I heard a story about an overdose death actually that occurred right around Thanksgiving here in our community. And so we had 2 back-to-back. We had an overdose death on Thursday and one on Friday, Thanksgiving, and the day after, Black Friday. And the story that I was being told was that this witness overdosed on drugs, and the decedent, the person who passed away, videotaped them basically dying, came back to life, and then the person who did the videotaping actually passed away. And I was having this conversation about how that's normal life for these addicts, for these folks that are addicted to drugs, that they see their friends and and I say friends loosely because they're not really friends. They're associates. They're only in it for each other to continue the drug cycle.
Yeah.
But they see each other pass out and die regularly, and that's not abnormal to them. And so that's why I say, having them segregated in our jail, treating these issues and letting them know that it's not normal to see someone die on a couch. It's not normal to use Narcan to bring your friend back to life. Even though we do it. And there are folks who are, picking up Narcan from substance awareness, which is they offer for free. People can come in and get it. It's great. We want that to be out there.
To give them another chance.
To give them another chance. But that's not life. That's not living. That's not how things should be. And so we've just got to, keep moving forward and working on this issue to try and let people know that there is a path out. There is hope. And, we offer those services. So
we're going to take a short intermission, word from our sponsors. But when we come back, we'll talk about some of those paths that you just talked about, okay?
Yeah, absolutely. How to get into the new year and a new you.
That's right. During this giving season, donate in honor of her, the mom, the aunt, or best friend who has guided and loved you through thick and thin. Your gift to Treasure Coast Community Health will benefit women in Indian River County facing heart disease, cancer, and/or diabetes. Early diagnosis and treatment can help prevent life-altering complications, By celebrating women in your life, you provide vital health care for others, and we can't thank you enough. Donate at tcchinc.org.
Hi, Leah Waldo's. And as 2021 is nearing the end, the staff and management of Waldo's and the historic Driftwood Resort would like to wish everyone a wonderful holiday season and a happy and healthy new year.
If you've got a job to do, call Workhorse. We can remodel your whole home, your bathroom, your kitchen, or even just put a fresh coat of paint on whatever you need. We're not handyman, we're licensed and insured contractors. Find us on Facebook, Workhorse Residential Contractor.
For unto us a son is given, unto us a Savior is born. Merry Christmas from Chad and Joey Colquitt and everyone at Colquitt Air Conditioning, keeping Indian River County cool and comfortable since 1970.
If you operate a small business, you need services like payroll, tax compliance, HR tools, and other resources. You need Complete Employee Solutions. Vero Beach has a team of professionals, including Anthony Sammons, Matt McCain, and Jennifer Comer, who saw the need for competent payroll, HR, and employee leasing services. Call Complete Employee Solutions at 772-978-7277 or visit their website at CompleteEmployeeSolutions.com.
Hi, I'm Chris Nolan from the Nolan Group of RE/MAX Associated Realty. I'm looking for new agents that are eager to grow their professional future. The Nolan Group has state-of-the-art systems and coaching to maximize your success. For more information, visit nolanshow.com.
And welcome back to Community Conversations. This week, I'm delighted to have a good friend, Eric Flowers, in. He's the sheriff for Indian River County. And we've been talking at the beginning of the program about our increased collaboration. Treasure Coast Community Health has been providing services, medical services. We've also done some dental. I'm not sure we've gotten a lot of behavioral health off the ground yet, but we're working together to help improve the care to individuals in terms of their access and affordability and those types of things. But, Eric, you mentioned that there are a number of paths as we begin the new year. If someone did want to reach out and get some assistance, I know that many people tell me, I called, I couldn't get in, I called, I couldn't get in. But we do have the Mental Health Collaborative that has the Connection Center. And I don't know how many people use that, if the Sheriff's Department advocates it.
We do. Yeah, I actually just did an interview with Brett Hall, and that's going to be out on our social media, talking about the holidays, talking about what you can do if you're struggling with some of these issues. And he goes through the numbers, and I want to say it was something like 5,000 people that they've seen come through those doors. I mean, it's really incredible. But no other community has what we have with the McCabe Connection Center. And I feel very blessed that I was in on that from the ground floor back when we, it wasn't even formed yet. We didn't even have a 501c3. I know you've been involved in the process the entire time. And the idea was that we had this loose connection of mental health providers in the community. We recognized that there was no clear path to getting mental health help. And so people would call up an individual psychiatrist or, you know, an individual area and say, I need help. And they just get the runaround. And so here in Indian River County, if you're interested in getting help for mental health, the McCabe Connection Center is the place to go. It's right downtown. It's on 14th Avenue. You can go in there Monday through Friday, 9 to 5. You can pop in and see Brett, see any of the staff, and they will walk you through your case. They will say, okay, it sounds like you need triage. It sounds like you have
everyone
housing.
thinks they need a psychiatrist, and the reality is that oftentimes they need someone to talk to, not necessarily the medication-assisted skills of a psychiatrist, because he's point blank about it. Psychiatrists no longer want to do counseling. They have the brain science down pat and how pharmaceuticals may help each one or not. And so that's really their main business, that medicine piece of it.
Yes. And so we have the ability, you know, to refer people over to the Connection Center because, you know, there are people who are in crisis that need law enforcement. There are people who we get calls about on 911, and people, you know, that's normal. People understand that is that side of our job and how we respond to those things. And we have a system in place where we can take folks to the hospital. We can get them stabilized. But if you're somebody out there that's not in crisis, but you're depressed or you're struggling with you know, the holidays or a new year,
or your teenager is struggling,
and they don't know where to turn to and they don't know how to navigate that system. The best part about this is that you can go right to Brett. You can go to the Connection Center, and they will help you navigate it. They will run.
They don't provide the service, though.
No, no services. Mental Health Collaborative does not provide any services. They are simply a navigation piece. They're a compass. Yeah, and quickly they will get you an appointment. If you're somebody who's homeless and you need transportation, they'll help you get transportation to the actual visit. You know, they worked in housing, they've worked with substance abuse issues. So anything that falls under that area, you can just pop in there and see them. And we're blessed to be able to have that in our community, because I can tell you there's nowhere else that has that.
It's like a matchmaking service, because in the old days, life was pretty simple, but now we have so many different insurance companies. We have people without insurance.
Yes.
You know, all of those barriers, Brett and his staff navigate them very easily, and it's wonderful.
And I got to tell you, I have to give a huge shout out to Brett. You know, in law enforcement, we see and hear things that nobody in life should ever see or hear. And my team had started down this peer counseling path. And I reached out to Brett and said, hey, you know, I've got some folks that are really hurting. They've been through some stuff, and can you help them? And so he came over and became a part of that. And now we have this collaboration where he is a part of our peer counseling team. We have folks who have been through training, and it all occurs on Brett's side of the house. So it's not anything where, you know, our folks are, you know, it's separate. They can go there and feel that they can talk. It's not going to get back to me or the agency. It's not anything, you know, they can say, I'm struggling. Here's what I'm dealing with. And they feel comfortable and confident talking to Brett. And so I'm so grateful and thankful. We just had our reaccreditation process for corrections and law enforcement. And I sat at the table with the accreditation team and I said, what are we doing right? What are you taking back with you? And they said, your peer counseling. We've never seen anything like it. We want this. I got to take it back. And so that made me feel really good. And that was actually Lieutenant from Monroe County, which is the Keys, 172 miles long, much larger agency than us. And when he comes and says, I'm blown away with your peer counseling, that makes me feel great. And it makes me feel good about the services that our team is receiving that helps them do their job every day, because you can't go out and do this job if you're hurting.
Yeah.
You know, if you're hurting every day, you can't be out there trying to help somebody else when you're not helped.
Absolutely. Can you tell? I couldn't smile any wider, because I'm just hearing about this for the first time.
Yeah.
And I'm just so proud of that connection.
It worked out well.
That has worked out. The other path, obviously, not everybody struggles from depression, you know, by sitting at home, just staring at the walls. Usually there's an elbow bend or a reach out for something to make that sad feeling go away. And so, again, walk-in services at the Substance Awareness Center.
Yes.
They have just been phenomenal, again, in downtown Vero on 14th. Sorry that we don't have these extensions up in the northern portion of the county. Maybe someday. I keep petitioning.
Yeah, I think we will get there for sure.
But that is an available spot. And it doesn't have to be the individual. It can be a family member that reaches out and says, give me some advice on how to handle this.
For both of those organizations,
Yes.
for the Substance Awareness and for Mental Health Collaborative, we actually refer probably more family members than we do actual patients. Because we get people who are struggling. They say, my loved one is having this problem. How do I deal with it? And, they probably need counseling too, to get through what they've seen with their loved one.
Absolutely.
And so to be able to have those resources to be able to refer people is just phenomenal, and just great partners.
Yeah, and the Mental Health Collaborative continues on, and so they are continuing to look at what other things can we do to erode the fragmentation that inevitably happens with different organizations and identify a community need for a group of individuals. And so last year, with the assistance of the Hospital Taxing District, they came together, this group of collaborators on the mental health side came together and talked about how difficult it is for our teens and young adults.
Yes.
And so as a result, there was an RFP process, and now we're starting to see the very initial graduates from an intensive outpatient treatment program that's being run by Cleveland Clinic over at their behavioral health center. So again, there are those resources that are out there. It's just taking that first step. I know it's really hard, particularly if it's not you, if it's a loved one. It's like, I don't know if I need to be the intervener in this. Maybe if, this or this or this happens, they'll get better on their own and I won't have to, announce this.
Well, you and I were recently in a meeting together with the hospital district, with the funders for that program, talking about the success stories. And it's just incredible to hear about these teens who would otherwise probably end up with me. They'd probably be at the jail. They'd probably end up in prison.
They're angry.
They are. They're upset. They've got a lot of trauma, a lot of things that have happened in their lives. And to be able to take that program, to have someone who's there for them, who's working with their parents on the other side, and all that is covered. Something that a lot of those folks wouldn't be able to afford. It's something that the hospital district is doing, and it makes our community better. Those are success stories, people who aren't getting locked up, people who aren't turning to drugs, and they're able to stay in the community. It's outpatient. It's less expensive.
They go to school every day, so that eliminates that stigma, being hauled out during class or missing school, being in the court programs, So 13 to 18-year-olds, if you want more information about that, again, you can call out to either the Connection Center or directly to the Behavioral Health Center and ask about their IOP program, Intensive Outpatient, because I know that is going to start expanding based on the success stories that we have.
And I think that outpatient is really a great thing for our community, because most people cannot pick up their lives and go into a treatment facility. Most people cannot pick up their lives and go into a rehab facility. To offer outpatient treatment is the best way to do it. It's the cheapest way. We're not housing people when we're doing that. And I just think it's the path forward for our country too.
But a big shout out to the funders who are willing to help with that greater societal endeavor, because as you say, many people just can't afford it, and what a difference it makes in their lives. So
I know Community Foundation's involved in that. I think Johns Island Service League is involved. There's so many dollars that are coming from great philanthropic people in our community who are willing to help. And it's great to be a part of the system, to have that, to have the feeling that, like you and I, when we step up and say, hey, this is a problem, we have people in our community that go, okay, I want to help. I mean, that just feels great. It really does.
Absolutely. So if you are one of those people, give the Hospital Tax District. They've already gone through the tax dollars, but there are many nonprofits that are doing this heavy lifting for individuals day in and day out, being there for them if you can't. And so that really does help.
As a fiscal conservative, it makes me feel good knowing that it's the taxpayer has some skin in the game, but you've also got these other folks who are willing to put their money up and say, we believe in you, and we believe that we can make these programs work. And then to see the success stories, it just really, really makes you happy.
Well, this is a real happy day for me as well, having you here, Eric. So thank you very much. And thank you all for being with us. And I hope the rest of your day goes very, very well, and your year too. And we'll talk to you next week. Thank you.